Deep within the intricate web of life, there exists a microscopic foe, the bacterium Yersinia pestis. This tiny organism, invisible to the naked eye, is the culprit behind one of history's most feared diseases, the plague. This tiny organism, invisible to the naked eye, is the culprit behind one of history's most feared diseases, the plague. The plague, also known as the Black Death, decimated populations and reshaped societies. Yersinia pestis is a master of survival, thriving within the bodies of its hosts, and wreaking havoc on their systems. It invades the bloodstream, causing severe illness and often death if left untreated. Its ability to adapt and spread has made it a persistent threat to humans for centuries. The bacterium can be transmitted through flea bites, direct contact with infected tissues, or inhalation of respiratory droplets. Understanding this minuscule enemy is the first step in comprehending the larger story of the plague. Researchers have spent decades studying its mechanisms and developing ways to combat its spread. Yersinia pestis is a zoonotic bacterium, meaning it primarily resides in animal populations but can jump to humans. Rats and fleas are the primary vectors facilitating the transmission of the bacterium to human hosts. It is a highly adaptable organism, able to survive in various environments and within different hosts. This adaptability allows it to persist in nature, waiting for the opportunity to infect new victims. This adaptability, combined with its virulence, makes it a formidable opponent in the battle against infectious diseases. Scientists continue to study its genetic makeup to understand how it evades the immune system and causes such severe illness. The plague, while treatable today, continues to remind us of the delicate balance between humans and the microbial world. Modern medicine has developed antibiotics that can effectively treat the infection if caught early. The discovery of Yersinia pestis in the late 19th century marked a turning point in our understanding of the plague. Before this discovery, the cause of the plague was shrouded in mystery and fear. Scientists, for the first time, could identify the culprit behind this devastating illness. This identification was crucial in developing targeted treatments and preventive measures. This breakthrough paved the way for developing diagnostic tools and eventually effective treatments. Vaccines and antibiotics have since been developed, saving countless lives. However, the story of Yersinia pestis is not confined to the laboratory. It is a story deeply intertwined with human history, leaving an indelible mark on our collective memory. It is a story deeply intertwined with human history, leaving an indelible mark on our collective memory. The plague has influenced art, literature, and even the course of wars. The name Yersinia pestis itself speaks to the legacy of this bacterium. It is a reminder of the scientific advancements that have allowed us to combat such deadly pathogens. It is named after Alexander Yersin, the Swiss-French physician who identified the bacterium in 1894 during an outbreak of the plague in Hong Kong. Yersin's work was groundbreaking and set the stage for future research. Yersin's discovery was a pivotal moment in the fight against the plague, providing a crucial piece of the puzzle in understanding and combating this ancient enemy. His legacy lives on in the continued efforts to study and control infectious diseases. The plague's journey often begins in the humble burrow of a rodent, hidden away from the eyes of most humans. Rodents, particularly rats, serve as the primary reservoirs of the plague, harboring the bacteria that cause this deadly disease. These small creatures, often seen scurrying through urban environments or hidden in natural settings, play a crucial role in the transmission cycle. These animals can carry the bacteria without showing any signs of illness, unknowingly perpetuating the cycle of infection. Their interactions with each other and their environment help spread the bacteria further. Fleas, those tiny parasites that feast on the blood of mammals, act as the primary vectors, transmitting the plague from rodents to other animals, including humans. These minuscule creatures are often overlooked, yet they play a pivotal role in the spread of the disease. Fleas become infected with the plague bacteria when they feed on an infected rodent, ingesting the bacteria along with the blood. Once inside the flea, the bacteria begin to multiply rapidly. The bacteria multiply inside the flea's gut, eventually obstructing the digestive tract. This blockage is a critical step in the transmission process. This blockage prevents the flea from feeding properly, driving it to bite repeatedly in a desperate attempt to satiate its hunger. Each bite increases the chances of transmitting the bacteria to a new host. With each bite, the flea regurgitates infected blood back into the wound, transmitting the plague to its new host. This process is both efficient and deadly. This intricate relationship between rodent, flea, and bacteria highlights the complex ecological factors that contribute to the spread of the plague. Understanding these interactions is key to controlling the disease. While often perceived as a human disease, the plague is fundamentally an animal disease that occasionally spills over into human populations. Historical records show the devastating impact of such spillovers. Understanding this intricate web of interactions is crucial for developing effective plague prevention strategies. Scientists and researchers work tirelessly to unravel these complexities. Efforts to control rodent populations and limit their contact with humans are paramount in preventing plague outbreaks. This involves a combination of strategies and constant vigilance. This involves maintaining clean living spaces, securing food sources to prevent rodent access, and using rodenticides responsibly. Proper sanitation and food storage are essential. Public health campaigns aimed at educating communities about these practices play a vital role in breaking the chain of transmission and protecting human health. Community involvement and awareness are key to success. The plague, though caused by a single bacterium, can manifest in three distinct forms: bubonic, pneumonic, and septicemic. Each form presents with unique symptoms and levels of severity, reflecting the different ways can invade and impact the human body. Bubonic plague, the most common form, targets the lymphatic system, causing painful swellings known as buboes to appear near the bite site. Pneumonic plague, a more deadly form, directly infects the lungs, leading to severe respiratory distress. Septicemic plague, the rarest and most severe form, occurs when the bacteria enter the bloodstream, overwhelming the body's defenses and causing rapid organ failure. Each form of plague presents a unique challenge in terms of diagnosis and treatment. Bubonic plague, while serious, is often treatable with prompt antibiotic intervention. Pneumonic plague, however, requires immediate medical attention, as it can progress rapidly and lead to respiratory failure. Septicemic plague, with its swift and often overwhelming progression, carries the highest mortality rate. Understanding the different forms of plague is crucial for healthcare providers to provide timely and appropriate treatment. Early recognition of symptoms and prompt initiation of antibiotics are essential for improving patient outcomes. Public awareness about the various forms of plague and their associated risks can also encourage individuals to seek medical attention promptly if they suspect infection. Section 4. A bite, a breath, a silent killer. How plague spreads. The plague's ability to spread through various routes contributes to its fearsome reputation. While flea bites are the most common mode of transmission, particularly for bubonic plague, other pathways exist, each posing a unique threat. Pneumonic plague, unlike its bubonic counterpart, can spread directly from person to person through respiratory droplets released when an infected individual coughs or sneezes. This airborne transmission route makes pneumonic plague highly contagious, with the potential to spark rapid outbreaks, especially in densely populated areas. Contact with infected animals, either through bites or handling their carcasses, can also transmit the plague. Hunters, butchers, and individuals living in close proximity to rodent populations are at increased risk of contracting the plague through this route. Furthermore, septicemic plague, while rare, can develop as a complication of untreated bubonic or pneumonic plague, highlighting the importance of early diagnosis and treatment. Understanding the various transmission routes of the plague is critical for implementing effective control measures. Public health initiatives focused on rodent control, flea prevention, and raising awareness about the risks associated with handling dead animals are essential in limiting the spread of this deadly disease. Additionally, rapid identification and isolation of pneumonic plague cases are crucial for preventing large-scale outbreaks. Section 5. The Black Death's Calling Card, Recognizing the Symptoms. The plague, throughout history, has left a chilling mark on humanity, etched in our collective memory as a harbinger of fear and suffering. Its impact has been profound, shaping societies and altering the course of history. Recognizing the symptoms of this ancient disease is crucial for timely intervention and improving the odds of survival. Early detection can mean the difference between life and death. The plague's initial symptoms often mimic those of other illnesses, making early detection challenging. This similarity can lead to misdiagnosis and delayed treatment, which can be fatal. Fever, chills, headache, muscle aches, and weakness are common early signs, easily mistaken for the flu or other common infections. These symptoms can appear suddenly and escalate quickly, However, the plague has a calling card: swollen and painful lymph nodes known as buboes, which typically appear near the site of the flea bite. These buboes are a distinctive feature that sets the plague apart from other diseases. These buboes, often hot to the touch and filled with pus, are a hallmark of bubonic plague. They can grow to the size of an egg and are extremely painful. As the disease progresses, the symptoms become more severe and distinctive. The patient's condition can deteriorate rapidly, leading to more serious complications. Pneumonic plague manifests with coughing, difficulty breathing, chest pain, and bloody or watery sputum. This form of the plague affects the lungs and can be transmitted from person to person through respiratory droplets. Septicemic plague, the deadliest form, causes fever, chills, extreme weakness, abdominal pain, shock, and bleeding into the skin or other organs. This form of the plague can cause the skin to turn black due to tissue death. The skin may even turn black, a gruesome symptom that earned the plague its infamous moniker, the Black Death. This blackening of the skin is a result of necrosis, where the tissue dies and decays. Prompt recognition of these symptoms is paramount for improving the chances of survival. Early medical intervention can significantly reduce the mortality rate. If you experience any of these symptoms, especially after being bitten by fleas, handling rodents, or traveling to areas where plague is endemic, seek immediate medical attention. Awareness and vigilance are key in preventing the spread of this deadly disease. Early diagnosis and treatment with antibiotics are crucial for combating this potentially deadly disease. Timely medical care can save lives and prevent outbreaks.